on behalf, I'd like to welcome you and get the day started on behalf of my co-chair, Dr. Jordan Cohen, and we are both really delighted to welcome you to our second Global Forum Public Workshop, Educating for Practice, Learning How to Improve Health from Interprofessional Models Across the Continuum of Education to Practice. I'll say a few words before I introduce the chair of this workshop. So, looking around the room, we have a packed room of people representing so many different professions and so many different organizations, public health, pharmacy, academia, NGOs, and so on. And we are all here because we're really committed to interprofessional education. We would also like to welcome the webcast participants joining us from across the globe to partake in this really important dialogue and discussions. Interprofessional education now is really paramount for us being able to provide the kind of care, the quality care that we would like to provide. And it's really to meet global needs. It's not only our local needs. We have to think about how we can foster an environment that breaks down professional silos and encourage team-based learning approach. And we always say that we expect people to be team working and providing quality care, but we don't put them early on in environments that really teaches them that. We expect them to learn that after they finish. Engaging the professions, all the profession, and developing a shared vision, even though we really do have a shared mission, but without the dialogue about how we can accomplish this shared mission by shared avenues too, is paramount in our dialogues here. I always say, and I really believe, and many of you believe that too, that this is a golden moment. This is such an amazing momentum now, and we have to remember how this momentum started. Well, it started by individuals, but I think what really moved it to the next level are two reports that we continuously will have to refer to: the Lancet report on transforming health professions for a new century, transforming education to strengthen health systems, and the RWJ IOM report on the future of nursing, leading change, advancing health report. I think those two reports, they have lots of gems in them. We should always refer to them, and it's not that we want to implement the recommendations that are there, but at least we never start from scratch. There's a lot of data and a lot of information about the future of quality care. I think in addition to that, this is a momentum because the Carnegie reports also came out about the same time, and the Carnegie reports basically are also saying the same thing. We've got to transform medical education and nursing education, but it's really, we can't transform it without all educational, all professions and all education. This forum and workshop provides that kind of platform for all of us to think together, learn from each other, and learn from our colleagues internationally, globally. We, in our reports, in the Lancet report, we said we've learned there's so much wonderful best practices going on in different parts of the world. We should learn from that, but think locally about how we could do that. I think interdisciplinarity and interprofessionalism are the words, the concepts of the decade right now, and I think we are taking advantage of these partnerships that happen through those reports and through the work that's happening here. It's synergy, and really looking forward to an action-driven discussion for the next 2 days. Now I'd like to introduce the co-chairs, one of whom could not be here today. But let me introduce Dr. Lucinda Main, who also co-chaired the first workshop. So this is the second workshop. Dr. Main, who has been acting in many leadership roles in the pharmacy profession, currently serves as the Executive Vice President and CEO of the American Association of Colleges of Pharmacy, AACP, which is the leading advocate for high-quality pharmacy education and co-leading in the quest to interprofessional education. The vision of that organization is that academic pharmacy will work to transform the future of healthcare to create a world of healthy people. And I think we probably will all agree that that's what we really want. She's also president of the Pharmacy Workforce Center, which is charged with generating workforce data and conducting research. Prior to her visionary leadership of AACP, she served as the Senior Vice President for Policy, Planning, and Communication with the American Pharmacists Association, APHA, and as Speaker of APHA House and a trustee. She also served on the faculty of the University of Minnesota, where she practiced in the field of geriatric and was an associate dean at Samford University School of Pharmacy, so she has the two worlds of academia and organization, and her research is in aging, pharmacy, manpower, and immunizations. She is a graduate of Auburn University and received her doctorate at the University of Minnesota, and she's a board member of Research America. It's my absolute delight to introduce to you Dr. Lucinda Meehan.
Thank you so much. It's a pleasure to be here. It has been lovely to co-chair with Scott Reeves, who's ill. I wanted to mention that is the reason why he was not able to be with us today or tomorrow. We had a wonderful planning committee for these first two workshops. They're sitting here in the middle, and I thank you all for your excellent input and service. AACP was drawn to this forum because of its global nature and the focus on innovation in health professions education. And as my bio, which needs to be shortened, says, we have a vision for a transformed healthcare system where we end up with a world of healthy people. And I think most of you in the room and around the world share that vision with us. When the planning committee got together to think about how could we kick off a multi-year forum and a series of workshops, we were selectively drawn to the innovation of interprofessional education. While we recognize that that may not be the only innovation that we'll be talking about in the life of this forum, we really do think it's timely, it's critical. And I want to just reflect that many of us here were at a meeting in February of 2011, convened by HRSA and other key stakeholders. And for me, that was when the light came on, and I realized that we might, in fact, be successful in transforming health professions education to team-based care because the marketplace was finally ready. And in fact, was not only ready for this innovation, but they were beginning to demand it of us as educators, that they wanted team-ready players when they come out of our graduation portal. And so the first workshop, for those who might not have been here, really looked at what some of the nuts and bolts of interprofessional learning might be. But this one is selectively focused on the practice environment and the practice community. And what can we learn from mature integrated care delivery systems of a variety of sorts about the education practice interface and how we need to reorient our thinking and learning process effectively. And to kick that off, my principal role for the next day and a half is taskmaster. And Patricia is going to help me keep everybody on time because we have a packed schedule. And so I am now going to turn the microphone over to co-chair of the forum, Jordy Cohen, to introduce our keynote speaker. Thank you.